This video will cover myeloid neoplasms with germline predisposition. Okay, so remember guys how a Germ-X bottle is our symbol for germ cell tumors? So we're going to tweak that a bit to remember germline. This is a factory line producing Germ-X bottles, so this is our prompt to remember germline. Additionally, see how each worker has an apple? And remember how an apple is our symbol for myeloid because apple in Greek is Milo and Milo sounds like Milo? So put the apples together with the Germ-X factory line and we'll remember myeloid neoplasms with germline predisposition. Let's begin. 2 of the gene mutations are common in patients without a pre-existing disorder or organ dysfunction. Those genes are CEBPA and DDX41. We'll remember CEBPA with this celebrity doing some type of PA announcement here. Shorten the word celebrity and you get Seb, right? Then you just have to remember the PA announcement to add the letters PA to CB or SEB. Right next to the character is this flow chart. I thought this was a factory, not a doctor's office. Talk about not wanting your workers to call out sick, right? Anyways, remember how differential diagnosis is often abbreviated as DDX? So yes, you guessed it. The flow chart here of a differential diagnosis represents DDX41. Germline DDX41 mutations typically cause MDS in elderly patients. Our prompt for remembering MDS is a happy meal from this restaurant, because if you shorten the name of the restaurant, you get to MDS, right? Since the happy meal box is right next to the flow chart, we'll remember this is associated with the DDX41 germline mutation. And the box is also right next to this elderly person to really hammer in the fact that this germline mutation likely leads to MDS in elderly patients. Now let's move on to patients that have pre-existing platelet disorders. This area of the image even has this stack of plates, which is our symbol for platelets, to help us remember that these mutations are classically seen in patients who already have pre-existing platelet disorders. The genes to cover are RUNX1, ANKRD26, and ETV6. Remember that Wonka candy called Runts? Doesn't Runts sound like Runks? So this will help us remember RUNX1. I feel like this candy didn't ever get enough love, but maybe that was for a good reason. Okay, so I know that if you guys are watching these videos, there's a real high chance that you're avid Anki users. Anki kind of sounds like Anchored 26 or ANKRD26, the name of the gene, doesn't it? So this one gunner med student here who manages to somehow have a job while in med school and do Anki at his job will remind us of ANKRD26 or ANKRD26, however you want to say that. This one is straightforward. ETV6 is so similar to ATV, right? So that's our symbol for ETV6. Now let's move on to the last group of patients, which are those with other organ dysfunctions. Remember how alligators are our prompt for GATA because GATA sounds similar to alligator, kind of, or gator, GATA? So this poster here of an alligator and the phrase organ dysfunction above it will help us remember this third group of patients who have other organ dysfunctions and therefore tend to show mutations in the GATA2 gene. This is associated with many different disorders such as bone marrow failure syndromes, telomere biology disorders, neurofibromatosis, Noonan syndrome, and Down syndrome. I'm not going to represent each one of these. I think just remembering that GATA2 gene mutations in patients who are already showing some type of organ dysfunction may mean that they are more likely to develop a myeloid neoplasm due to this germline GATA2 mutation.